Welcome to the Deep Dive. Today, we're getting into something really important, something that can genuinely put you in control of your health. Personal health records, PHRs.
That's right.
We've sifted through quite a bit of information from sources like Joint Commission International, University of Minnesota, PMD Alliance, NABH, Supremedic, HospiMatch, Datavant, Mayo Clinic, and, well, a bunch of articles and other discussions.
Yeah, a lot of material.
And our mission today is pretty simple. We want to equip you with the know-how to really manage your own health information effectively.
Absolutely. Because, these days our health journey isn't always straightforward. You see different doctors, different systems. Having your own data organized, it's less of a nice to have and more, essential for making good decisions.
Okay, let's dive right in then. What is a personal health record, specifically? It kind of sounds like something only doctors would have or need.
No, not really. Think of it more like your personal health diary or story. It's collected and managed entirely by you.
By me?
Yes. It's a central spot where you keep all the important bits, past illnesses, current meds, allergies, that kind of thing. And the key thing is you're in the driver's seat.
Okay.
You decide what's in it, you keep it current, and you choose who gets to see it, if anyone. It could be super simple, like just a binder at home.
A binder.
Or it could be a secure app or website on your phone or computer. Lots of options.
So it's like my own health filing cabinet, basically.
Yeah.
But it belongs to me, not my doctor's office.
Precisely. That's a really crucial distinction. The EMRs, electronic medical records, or EHRs, electronic health records.
Yeah, part of those terms.
Right. Those are the systems your doctors and hospitals use. They own them. They maintain them. You might get access to bits through a patient portal, maybe.
Okay.
But your PHR is fundamentally your personal thing. It's portable. It goes with you.
Right. I see the difference now. But, honestly, it sounds like it could be a fair bit of effort.
Yeah.
Keeping track of all that. Why should I really bother?
That's a fair question. It does take some initial effort. But think about a really common situation. Say you move.
Right.
New city, new doctor needed. How do you give that new doctor your full history? Usually it means calling old clinics, getting records sent.
Oh, yeah, that could be a pain.
And slow.
Exactly. And things get missed sometimes. A PHR just, it cuts through all that. You've got the core information right there.
Okay, that makes sense for big changes like moving. But what about just everyday life?
Well, think about this scenario. What if you suddenly got sick or had an accident while traveling? Or even just at work? Would the people helping you know about a serious allergy? Or a medication you absolutely can't miss?
Probably not, no.
A good PHR can literally speak for you when you can't. That quick access to critical info like allergies or meds can be incredibly important in an emergency.
Okay, yeah, that's a powerful point. You've convinced me it's more than just convenient record keeping. So let's talk benefits. Beyond having info handy, what are the real advantages here? Oh, the benefits are pretty significant. Let's start with coordinating your care.
Coordinating care.
Yeah. So one source mentioned a survey suggesting the average person might see 18 different doctors over their lifetime, maybe even more.
18? Wow.
I know, right? So imagine trying to make sure every single one of them has the full picture. It's tough. Your PHR acts like that central hub. It makes sharing your whole story with a new specialist, or even just your regular doctor, much, much simpler.
18 doctors.
Yeah.
Yeah, I can see how wires could get crossed easily.
Definitely. And that leads straight into the second big benefit, reducing medical errors.
Oh, okay. Errors.
Yeah, and this is serious. One analysis mentioned potentially up to 80,000 deaths a year linked to doctors just not having the patient info they needed.
80,000? That's staggering.
It really is. Think about simple things like different doctors prescribing meds without knowing everything else you're taking. A PHR where you've listed everything can help catch potentially dangerous interactions. It's a safety check.
That's a very sobering statistic, having it all in one place you control. It really does sound like a vital safety net.
It absolutely can be. Okay, third benefit, emergency access.
Right, you touched on this.
Yeah. What if you need your medical info, right now, middle of the night? Or you're overseas?
Yeah, you can't just call your doctor's office.
Exactly. An online or digital PHR means you can potentially get that critical information 24/7. And studies show emergency docs really value that immediate access. It helps them make faster, more accurate decisions when time is critical.
Makes total sense. In an emergency, speed and accuracy are everything.
And finally, number 4, A PHR can really help with improved follow-through.
Follow through. How so?
Well, you know how it is. You leave the doctor's office, your head's swimming with information, instructions.
Oh, yeah. I forget half of it by the time I get home.
We all do. Your PHR can be the place you write down those instructions, your health goals, maybe track your blood pressure readings at home or glucose levels, whatever it is. It makes sticking to the plan and seeing your progress much easier.
So it's not just backward-looking history, it's also a tool for managing things going forward, actively.
Precisely. It empowers you to be proactive. So now that we've kind of covered the why it's important, maybe we should get into the what. Like, what exactly should you put in your PHR?
Yeah, okay. This feels like he could get overwhelming quickly. Where do you even start?
Yep.
What's the essential stuff?
Right, let's break it down. Based on recommendations from, places like the University of Minnesota, PMD Alliance, and others, there are core categories. First, the obvious, personal information.
Like name and birthday.
Exactly. Full name, date of birth, your blood type if you know it, that's super useful, and definitely your emergency contacts. Who to call, their number.
Got it. The basics.
Then list out your healthcare providers. Names, addresses, phone numbers for everyone. Your main doctor, specialist, dentist, eye doctor.
The whole team.
The whole team. And right alongside that, your insurance information. The company name, policy numbers, contact numbers.
Okay. And I guess you'd need to keep that insurance part updated if it changes.
Absolutely critical. Keep it current. Next, a really key section. Current medications.
Okay.
You need the exact name, the dosage, how often you take it, and who prescribed it. And this isn't just prescriptions. Include over-the-counter stuff you take regularly, vitamins, supplements, everything.
Everything, even like daily vitamins.
Yep, because they can sometimes interact with other things. And, crucially, list any and all allergies, meds, food, environmental stuff like latex or pollen. Be specific.
Okay, meds and allergies, got it. What about past stuff, like surgeries or big illnesses?
Vital. Include your medical history. Any significant illnesses, any surgeries, try to note the approximate date and maybe where it was done. Chronic conditions like diabetes or asthma, and also any hereditary conditions that run in your family.
Family history, right.
And don't forget vaccination records. Dates for tetanus, flu shots, COVID vaccines, childhood immunizations if you have them.
Okay, the list is getting pretty long.
Yeah.
But I see how it builds a picture.
It does. We're nearly there. It's also really helpful to include important test results.
Like blood work.
Yeah, recent lab results. Maybe summaries from eye exams or dental records if there was something significant. Reports from x-rays, MRIs, scans. If you can, keep both the summary and the actual report sheet.
Okay.
And tied to that, doctor visit notes and prescriptions, key details about diagnoses, treatments, maybe discharge summaries from hospital stays.
That's pretty comprehensive. Is there anything else? Like lifestyle stuff?
Yeah, definitely consider adding other relevant information. Things like your regular exercise routine, maybe details about counseling if applicable, and really importantly, any advanced directives like a living will or healthcare power of attorney.
Ah, okay. End-of-life planning docs.
Exactly. And maybe even just personal notes from appointments or logs of calls with your insurance company. The more complete it is, the more useful it becomes.
Wow. Okay, I can really see now how having all that pulled together in one spot would be incredibly powerful, especially, like you said, for a new doctor or an emergency. So, practically speaking, how do you actually do this? Are we talking paper, digital? What are the options?
Good question. You've got a few main ways to go, and each has its pros and cons. The simplest is probably the paper file.
Like the binder you mentioned.
Exactly. A 3-ring binder, dividers for sections like meds, allergies, visits. It's straightforward, good if you're not super techie. The big downside, obviously, is it can get lost, damaged, or you might just forget it when you need it.
Right. A binder isn't much use if you're on vacation and have an emergency. So digital options.
Yeah, digitally, there are several paths. First, check your health insurance company's website or app. Many offer some kind of PHR tool.
Oh, really?
Yeah, it can be convenient since you probably already have an account. But one thing to check is portability. Can you easily take your data with you if you switch insurers later? That's important.
Good point. What else?
Then there are dedicated PHR apps, lots of them out there for your phone or tablet. Names like Capsule PHR, Tidy Health, Talk PHR, Health Spec, MTBC PHR pop up.
Apps specifically for this.
Right. They offer accessibility, easy sharing features sometimes, maybe medication reminders. But yeah, you need to be comfortable using apps.
Okay. Any other digital ways?
Sure. You could just use cloud storage like Google Drive, Dropbox, something similar. Scan your paper documents and store them securely online. That gives you a backup you could access anywhere.
Like a digital filing cabinet.
Kind of, yeah. And in some places, like India, there are specific government initiatives like DigiLocker or the Health ID, ABHA, designed for secure digital health record storage.
Interesting.
And one thing not to overlook, the medical ID feature on smartphones.
Oh, yeah, you mentioned that for emergencies.
Exactly. iPhones have it built in, accessible from the lock screen. Android has similar apps you can get. It's designed for first responders, shows allergies, meds, conditions, blood type, emergency contacts. Crucial stuff.
That medical ID sounds like something everyone should set up, like, right now.
Honestly, yes. It takes 5 minutes and could be incredibly important. Now, often the most practical solution for many people is actually a hybrid approach.
Hybrid, meaning?
Meaning keep paper copies of really critical documents, maybe your advanced directives or recent summaries somewhere safe at home, but also have digital versions, maybe use an app or cloud storage for accessibility and backup. Best of both worlds, kind of.
Okay, that makes sense. Redundancy. Now, you mentioned storing stuff online. Privacy is a big concern, right?
Yeah.
Especially with health information.
Absolutely. It's a huge consideration and a very valid one. It's true that in the US, for example, not all these online PHR tools fall directly under HIPAA regulations in the same way your doctor's records do.
So they're not protected.
Well, most reputable services have their own privacy policies and security measures. They usually use encryption, secure servers, things like that. But the key is you need to read that policy before you sign up. Understand how they protect your data, who might have access, what they do with it. Choose services you trust.
Okay, so do your homework on the provider's privacy rules. Got it. So if someone's listening and thinking, okay, I want to do this, where should they start? It still feels like a potentially big project.
Start small. Don't try to do it all in one afternoon. A good first step.
Yeah.
Maybe check with your health insurance provider, see what tools they offer online. That might be the easiest entry point.
Okay.
Second, maybe browse a few of those dedicated apps or websites we mentioned. See if one clicks with you, looks easy to use. And definitely, step 3, set up that medical ID on your smartphone today. Seriously, that's quick win.
What about those patient portals my doctor's office has? Is that my PHR? Should I just use that?
That's a really common question. Those patient portals are great tools. Definitely use them if you have access.
Yeah.
They're often linked to the doctor's own electronic health record system. You can usually see appointment reminders, maybe message the office, see test results from that practice, view the medication list they have on file for you.
So they are useful.
Very useful, but, and this is the key thing, it's generally not the same as a comprehensive personal health record that you control. The portal shows you what that specific doctor or clinic has recorded about you.
Ah, I see.
Your PHR is supposed to bring together information from all your different doctors, dentists, specialists, maybe stuff you track yourself, into one complete picture that you manage. The portal is just one piece of that bigger puzzle.
Okay, that clears it up. The portal is the doctor's view. The PHR is my complete view.
Exactly. Well put.
All right. We've covered a lot today. What a PHR is, the why, the benefits, the what goes in it, the how paper versus digital privacy getting started. So boiling it all down, what's the main thing you want people to take away?
I think the core message is this. A personal health record is genuinely a tool for empowerment. It puts you, the patient, in a much more active, informed position within your own healthcare.
Empowerment, I like that.
Yeah. By taking that step to centralize your information, you can really improve communication with doctors, you can help reduce those risks of errors from missing information, you ensure you've got vital details in an emergency, and ultimately, you just gain more control over managing your health. Think of it like your health passport.
A health passport. That's a fantastic analogy. It helps you navigate the healthcare system.
Exactly. Ensures continuity, clarity, wherever you go.
Okay. So for our final thought today, think back to your last doctor's visit. Was there anything, any detail you struggled to recall or had to dig around for later? Creating a PHR, even starting small, paper or digital, can help avoid that uncertainty next time. So here's a little challenge for you listening. What's just one piece of health information you can find and add to your personal health record, or start one with today? Maybe just writing down your current medications or finding your allergy list.
Yeah, just one thing.
Consider that your first concrete step toward taking deeper ownership of your health journey.